Welcome to our last online clinical teaching on the run session. Today I will be addressing the topic of feedback. Is your feedback helping or hurting your learner? I am Dr. Leslie Ann Sadownik, and I will be walking you through this online presentation. In this series of presentations, we have reviewed some key principles about how to teach effectively in the clinical setting. The topic of our last session was why we should observe learners with patience. Today, we will be focusing on how to provide useful information to the learner to help them improve their clinical performance. We discussed how adults will learn a skill more effectively if they deliberately practice that skill. Deliberate practice is characterized by focusing on an aspect of performance, getting feedback immediately after that performance, then performing the same task repeatedly. Feedback is a very large topic. In this online presentation, I will be limiting the discussion to feedback as one of the steps in the deliberate practice of a clinical skill. I will discuss what information to give to learners verbally about their clinical performance and how to help learners improve that performance by providing SMART performance goals. So we will focus on delivering feedback to a learner after they have performed a specific task. This task should be relevant to the medical learner's job description. It may involve information gathering, clinical examination, and/or communication skills. When we watch a learner perform a skill, it is important to know what we are looking at and what we are looking for. That is because feedback in the context of medical education can be defined as specific information about the comparison between a trainee's observed clinical performance and a standard of that performance. Information is then given to the learner with the intent to improve the trainee's clinical performance. As clinical experts, it is assumed that we have a clear idea of what is the gold standard of performance. However, most of us just know when something does not look right. We sometimes struggle with defining why it does not look right and giving specific, clear instructions to our learner. Our verbal feedback to learners is often vague or nonspecific and does not provide the information they need to modify their behaviors. There are many assessment tools and/or video resources that can help guide our observation and aid in assessing the learner's performance as compared to an ideal performance. They can help to train our observer's eye. But what do we do with this information? What is the best way to give feedback to the learner? Let's assume that you and the learner have identified a skill that they would like to work on. You both have an idea about what the ideal and/or standard performance looks like. You observe the learner's performance and record what you heard or what you saw. You want to describe specific behaviors that need to be improved or can be enhanced. Try not to comment only on overall performance, such as you need to work on your communication skills. Rather, be more specific. Label what was said or how it was said and why the behavior needs to be modified. For example, when taking the patient's history, I noticed you spent most of the time looking at her chart while taking your notes. It is important to maintain eye contact with the patient so that they feel like you're actively listening to their story. Try and limit your note taking to points during the patient's interview. Perhaps you observed a learner counseling a patient on how to manage a chronic disease such as high blood pressure. This counseling session took 10 minutes, and you have jotted down a bunch of notes. You used the 4-quadrant system I introduced at our last session to record your observations. You review your notes after the observation and realize that you have jotted down a lot of different things. You will have picked up multiple things that you think the learner did wrong or needs to improve. Some of it you may feel is must do, and other points are nice to do. Some of it is easy to address, and other aspects of their performance will be more difficult. At this point, it is important to prioritize and decide upon what information you will share with the learner about their performance. Too much feedback can be overwhelming to the learner and dilute your message. Ask yourself, if I could improve one thing about this learner's performance at this time, what would it be? Think carefully. Okay, after you have planned your message, you will want to deliver it in a timely manner. It is best if you discuss what you saw or what you heard immediately after the learner performs their task. But sometimes that may not be possible. You may need to delay the discussion. Perhaps your clinic is too busy or your learner is too tired or distracted to listen effectively. Remember, perspectives do matter. If you delay the feedback too long, the learner may not recall their performance. When you discuss your observations, check with the learner that they agree with your observations. You can always ask the learner to begin by assessing their own clinical performance, what they thought they did well, and how they would change the performance in the future. What would they like to work on? What needs improving? Then you can share your perspective. It is sometimes helpful to revisit the gold standard of performance before discussing what you observed. Remember, feedback is a discussion. Okay, so you and the learner have discussed your observations of their clinical performance. Don't stop there. You need a plan to help the learner improve the performance. After all, the purpose of feedback is to help them improve. Thus, your plan should include SMART goals. We discussed how important it is to be specific about the information you provide about how to improve their performance. You should also be able to measure this improvement, how well you and the learner know that they are progressing. Is the performance goal achievable? Is it within their zone of development? Is it appropriate for their level of training? Is the performance goal realistic and relevant to the learner? Learners will be more motivated to practice a skill that they use on a regular basis. Will the learner have the opportunity to practice the skill in the future? Observing and giving feedback to learners is in itself a skill that benefits from deliberate practice. To begin with, try and practice the skill on a regular basis with learners whose skills are basically sound or competent, but certainly could be improved. Focus on an aspect of their performance. Familiarize yourself with standards of performance. Train your observer eye. Then get in the habit of observing and labeling their behaviors. Limit your feedback to aspects of the learner's performance for which you can set SMART performance goals. There's no sense in addressing an aspect of the performance for which you have no advice or guidance. The learner should have the opportunity to practice the skill, and you should be able to observe improvements in their performance. So both the learner and the preceptor have an important role in the deliberate practice of clinical skills. The preceptor can start by obtaining an educational history from the learner. The preceptor and the learner can develop an educational plan that focuses on an aspect of the learner's clinical performance. The preceptor can then observe the learner perform that task. The preceptor then provides guidance on how to improve that skill. The learner practices deliberately, and the preceptor observes this practice over time. If the learner's performance improves under your supervision, this is the feedback to you that your teaching is effective. Thank you for taking the time to listen to this online presentation. Feel free to visit our faculty development website for other opportunities to engage in online or face-to-face faculty development. If you enjoyed these brief online presentations, I encourage you to try our interactive online modules or register for our face-to-face interactive workshops.